Hello, who am I speaking here with today?
My name is Lisa Pittman.
And where do you work and what position do you hold?
Well, currently I'm a retired nurse, but I held a position for 33, 34 years. And I held several positions while I was at the hospital. And then I went into hospice care at the end of my career.
Gotcha. So, our first question here is, do you see more cancer and health problems progress in patients subject to environmental racism or placism in society?
I feel like that's a true statement. I have dealt with patients that are low income, low education, and I see where they don't catch or let their problems go on longer before they seek help. And a lot of times you're into a stage 3 or 4 cancer before they ever even seek help from a professional. Also, a lot of times they just don't know what to do. And so I've dealt with people that work at companies that have advocates that help them. But still, with them coming, a lot of times they come from low economic countries where they don't have good health care, and so they don't know exactly what to do. So yes, I feel like that the cancer would progress on to a higher stage, whereas somebody from this country probably would seek earlier help and have a better outcome.
I could see that. Could you describe a time or situation that you made or actively make a decision based on what was best for your team versus what is best for you as an individual?
Policy in healthcare is to do what's best for the patient. The motto is do no harm. A lot of times the patient's not happy with what you're asking them to do, but you're basically trying to get them to do what's best for them. So as far as doing what's best for the company versus what's best for the patient, I don't feel like healthcare works that way. However, we have to deal with insurance companies, and a lot of times insurance companies make the medical field jump through hoops to get the care that these patients need. So yeah, there is a give and take as far as that's concerned.
I bet insurance does play a really big role, and that would make things very tough for you guys at times.
Oh, yes.
How long have you worked in this type of area, and how did you initially get involved in it?
I went to college 10 years out of high school. I worked in healthcare since 1989. And I have worked in several different fields in the hospital during those years. I worked on a general medical floor. I did what's called a discharge team, where you get everything together to make sure that they have the best discharge possible so that they will continue to do well once they get home. I went ahead and certified in wounds, and I enjoyed that immensely. I got to see a lot of healing with the wounds, whereas on a general medical floor, they're 1 day, 2 days, 3 days a week, and they're gone. Whereas with the wounds, I worked tandem with what's called the wound clinic in the hospital, so I got to see my patients after I started their wound care progress to healing through the wound clinic. So I really enjoyed that. And at the end of my career, I did hospice, and that was a very eye-opening and a very, very heartwarming part of my career, because you got to see a lot of patients that knew they were at the end of life, and hopefully I was able to make their time that they had left a little better.
Yes. That is very important, especially in the healthcare field. So, how did you initially get involved with this specific organization?
Like I said, I went to the hospital straight out of college, and I worked there almost to the end of my career. I worked there like 31 years. And I went there because it was the hospital in my hometown. I could have gone across the bridge and worked in Indiana, but I felt like I wanted to be at home. So that's basically how I got involved with the organization.
There is nothing like home, especially our hospital. They do great things. So what type of work does this organization do, and what specifically do you do for the organization?
Well, I'm going to basically be repeating myself a little bit. It's healthcare. I mean, we take acute care patients through the ER, and if necessary, they're admitted into the hospital where the nurses do, under the observation of the physicians, take care of the patients and hopefully send them home with a better outcome.
So if you had to summarize the types of principles that guide your organization, for example, justice, promoting well-being, repairing harm, caring for the less fortunate, etc., what principles would you choose?
Caring for their well-being. I mean, a lot of these patients come into the hospital. They've been sick for a long time. They don't feel well. So basically, we bring them in. A lot of times they might not have the things at home that they need, especially some of the elderly. So they may not have hot meals, not feel like cooking them a hot meal. So we have a dietary that come in and feed them nutritious meals. We have the nursing, of course, that give them the medications, and especially like pain medicines, because a lot of times the little elderly people have things besides what's going on with them acutely. They might have arthritis or some stomach ailments or something like that. So we help take care of that. And also we have social workers in the hospital that help make their home life a little better and help them get supplies and that kind of thing. We have case managers that help with the insurance dealing with them. So we basically treat the whole person, not just their illness.
And what do these principles mean to you?
They mean to me that we're making somebody's life better, and we're not everybody appreciates it, because we're asking them when we come into our organization not to smoke, not to drink, not to do drugs, and they don't always appreciate that. We also have issues. There is a law called HEPA law where we can only discuss a patient with people that they say we can discuss their problems with, and also unless it's like a doctor or another nurse that's involved with that patient's care. So HEPA is very important in the nursing and medical career.
I could definitely see that. So are there any standard protocols in your profession that you use to make decisions on these things?
There are several protocols. As a matter of fact, I worked with some of the other nurses to develop some of these protocols. As a matter of fact, when I was working as the wound nurse, I developed protocols as to how and what I could do as far as taking care of a patient. And the doctors, of course, had to oversee that. But it freed me up to be able to care for a patient the way I felt like they needed to be cared for. So I would, develop the protocols as far as wounds were concerned, and then the doctors would approve or disapprove or change or whatever. So I worked with a lot of surgeons, and after they figure out that you care about what you're doing, they would work with you and help you develop a plan as far as it is to care for the patients. And then our goal is, of course, to heal the patient. So that's why the protocols are there.
And so, on what basis do you determine what ought to be done when these conflicts arise?
I was certified in wound care while I was in the hospital. I also, as a general medical nurse, I went to college and nursing school as to help. And then after that, I had a preceptor that was there to help me get started when I was nursing. So I actually had a lot of education as far as it's concerned to know what to do in different situations. And through the years, you learn how to take care of certain situations, and you're never too young to learn. So lots of new things arise, and new protocols and new developments and best practice come into play as far as that's concerned.
That is really cool that you got to specialize in wound care like that. So, what are the challenges that you face in the work that you do?
A lot of the challenges were there's a lot of pain, and until you can get that under control, you can't really do what you need to do to heal somebody. As far as with myself, I did the wound care, and a lot of times it was hard to get the patient's equipment they needed when they go home, the dressings. Insurances, of course, came into play where that was concerned. They might pay for the machine that you needed, but they might not pay for the dressings. So wound care equipment and dressings are very expensive, and a lot of times the patients couldn't afford them, and I'd have to find a different way to care for that patient that would be a more affordable way to deal with it. So
I like how you always say you always don't try to do any harm.
That's right.
So, what motivates you to continue in your work even when these things get difficult?
Nursing's a hard job, and you don't always get a lot of gratitude as far as it's concerned, but anybody who's going into nursing for gratitude is going into it for the wrong reason. Nursing, to me, is to go in and take care of the patients and make their life a little better. However, it's not, a lot of times nurses get abused. I've had patients that were confused, and they've scratched, they've kicked, they've bit. So those were things you had to overcome and understand that they didn't really mean what they were doing. Family members sometimes feel guilty, and they take it out on the nurses. They a lot of times want to deal with the doctors and not the nurses, and the doctors are busy with what they do, so they're not always available for the patient, and they don't understand that. So there's different personalities with people, and you have to learn how to deal with each personality as they come.
That's a really big person of you to forgive people even when they bite and kick at you.
I've had curses put on me.
That is awful. So, are there any misconceptions that people have about the work that you do?
A lot of people think that nurses sit at the desk and chart, and that's it. And that's definitely not true. Nurses do anything from giving people food, changing dressings, changing diapers, bringing them a cup of coffee. I mean, a nurse's responsibilities don't just stop at charting. And as a matter of fact, charting was my least favorite thing to do. I was better with hands-on. And that's one of the reasons, the fact that I'm getting older, the charting was the hardest part of my life. But insurance companies, if you don't chart it, you didn't do it. So that's the life of a nurse, is chart.
I gotcha. So what do you wish more people understood about the work that you do?
I just wish people understood that nurses aren't perfect. We're under the dictation of doctors. We can't just do what they ask for the minute they ask for it, we have to contact a physician and get orders for what they're asking for. I wish they'd understand that they need to try a little patience and understanding. You don't always get that because they want what they want when they want it. And when they don't feel good, I always said the hardest patient in the world was a man who's in pain. You take away his food and you put him in a gown and you put him in a bed and tell him he has to stay in that room and not go downstairs and smoke. And that makes for a very unhappy patient.
I mean, to be fair, if someone were to put me in a gown and take away my food, I'd be upset. I'd be sad.
Right. And you have to explain to them that it's not because you're trying to be mean. You're trying to get them ready for the tests that it takes to figure out what's going on. So
Yes.
a lot of times they don't think in those regards.
So, what are some concrete ways that people can support your organization and get involved in the work that you're doing?
Be right truthful. Just appreciate the care that we give and have a little patience with us. I wish we could control what insurance companies dictate. And a lot of times the patient may not be ready to go home yet emotionally, but we have to send them home because they're physically ready. And so I wish they understood it's not us kicking them out of the hospital. It's our mandates. It's what we're told to do. So it's just, I wish they could understand that and not feel like it's personal on our part.
That is some really reasonable requests. But thank you so much for your time. Thank you for speaking with us today. This is Lisa Pittman, ADN Wound Care Specialist.